Hello everyone and welcome back for another informative health awareness session. This is Dr. Ramya Bevoor, your very own family physician, and in today's video I want to talk to you all about a very common illness that is spreading all across the country right now. I'm going to talk about something called as a pink eye or the eye flu. A lot of patients are presenting with symptoms like eye pain, discharge, itching, irritation, etc. So what is this? How is it caused? How do we treat it? And how can we prevent it? Let's look at some of these things in this short video today. So first of all, what is pink eye or eye flu? It is a condition called as conjunctivitis, which means an inflammation or swelling of the conjunctiva. Conjunctiva is a transparent layer of tissue which covers the white part of the eye, including the inner eyelids. In certain conditions, this can get inflamed and swollen, resulting in conjunctivitis. There are many causes of conjunctivitis, out of which three are most common, which is a viral conjunctivitis, bacterial conjunctivitis, and allergic conjunctivitis. Viral conjunctivitis is by far the most common. Almost 80% of all conjunctivitis is viral, usually due to adenovirus or enterovirus. Bacterial conjunctivitis can also happen because of bacteria like streptococcus, staphylococcus, gonorrhea, etc. Allergic conjunctivitis can be due to chemicals, or it could be because of allergens like pollen, dust, animal hair, etc. So, how does conjunctivitis spread and why is it so common in the monsoon? So, in the rainy season, the air has more moisture and humidity, which forms the perfect condition for viruses and bacteria to grow and spread, which is why a lot of infectious diseases, including conjunctivitis, are common during this season. How does conjunctivitis spread? It mainly spreads through a direct contact with the hands or objects that have been contaminated by the bacteria or viruses. It can also spread sometimes through respiratory droplets like sneezing, coughing, etc. What is the presentation of conjunctivitis? Patients with conjunctivitis normally present with redness of the eyes, itching, irritation, feeling of a foreign body sensation, watering, discharge, either watery or white discharge, and pain in the eyes as well. Sometimes patients can also have fever and they can have other respiratory symptoms like cold, running nose, sneezing, cough, etc. How do we treat conjunctivitis? Always remember that viral conjunctivitis is a self-limiting condition and normally gets better on its own within 2 to 3 weeks. There are no specific antiviral treatment as such available for a viral conjunctivitis. In case of a bacterial conjunctivitis, your doctor might prescribe you antibacterial eye drops like ciprofloxacin, ofloxacin, bacitracin, polymyxin, etc. These need to be applied in both your eyes every 2 to 6 hours for up to 5 to 7 days. You might also be prescribed some oral anti-inflammatory tablets if you have associated eye pain or fever. Always remember to never self-medicate with these drops, especially buying over the counter from the pharmacy, because you might be given antibacterial drops which have a steroid combination. The use of steroids for a conjunctivitis should be discouraged on a over-the-counter basis because it can have a lot of side effects. Only use steroid eye drops if it has been prescribed to you by your doctor. Please avoid self-medicating on your own. The second thing that we can do is the supportive treatment. This is mainly in the form of hot compresses and cold compresses. You can either dip a piece of cloth, a clean cloth, in hot water and place it over your eyes, which can give you comfort. And in the case of a viral or an allergic conjunctivitis, doing the same thing with cold water will give you some amount of comfort. You can also wash your eyes with flowing normal tap water frequently. That helps in giving you some relief. As well as please avoid straining your eyes by the use of mobile phones, laptops, watching a lot of television during this period, because that may delay your healing as well. So this is about the treatment of conjunctivitis. How do we prevent conjunctivitis? There are certain measures that we need to follow, like practicing safe hygiene. Make sure that you wash your hands regularly, especially if you have conjunctivitis or if you are around somebody who has conjunctivitis. Avoid rubbing your eyes or itching your eyes because that may worsen the condition. Also, avoid sharing things like eye cosmetics, contact lenses, glasses, goggles, towels, bedding, etc. Because it is through these things that conjunctivitis spreads very rampantly. Also, always remember that if you are down with the eye flu or conjunctivitis, please do not go out in a public place until your symptoms have improved, because you are putting a lot of other people at risk as well. So this was in short about the common illness right now, that is the pink eye. I hope this information has helped you. Please do remember to practice all the safe hygiene measures, avoid sharing items, and if you have these symptoms, kindly consult your doctor before self-medicating yourself. Please do feel free to comment and ask me any questions in case you have any doubts. I will be more than happy to answer. Thank you for watching. Have a good day. Bye.